My area of interest is gastrointestinal disorders, including doing endoscopic procedures for various conditions. And that can range from anything from reflux all the way down to colon cancer screening. The relationships I have with the patients are all dependent upon their diseases. So if it's an acute illness and that resolves, it's usually a short visit, a couple of visits with me, and usually that kind of ends it, and they'll follow up if they have an issue that arises again in the near future. Those who have chronic disorders, for example, Crohn's disease and ulcerative colitis, or those with liver disease, they end up being patients of ours for the length of their illness, and we see them periodically in the office as follow-ups, or sometimes in the hospital if they have a flare-up of their condition. Patients get very nervous coming to a gastroenterologist, and in particular, if they're going to have a scope, more so I think the colonoscopies, people get a little bit kind of nervous and shy about having that conversation, but it's something that is very important. And I also kind of go over how we're going to do it, and so that the patients understand what the procedure is. I think having the understanding and education usually helps patients be more relaxed about it when they know what to expect. The way I try to go with my patient care is to really approach a conversation, dialogue, try to work with the patient in a mutually acceptable plan. I think the best therapies and treatments are those that are going to be available to the patient that they can do themselves and comply with, and also affordability. I think that has to be a consideration for patients, and therefore it's a conversation piece between myself and the patient to come up with the best plan of action for their care. When you improve someone's life and they're much happier with what they have now compared to what they came in, I think it's a reassuring and a satisfying part of the job I do, and I think that's what keeps us going, is knowing that we have that potential to impact the patients dramatically. And when you do accomplish that, it's a great feeling.